hear me? Brilliant. So welcome to the side session on developing international funding guidelines to support integration of biodiversity conservation and medical service provision. My name is Jessica Stockdale and his name is Joe Middleton, and we are both based at the Brighton and Sussex Medical School in England. So I'm just going to give a breakdown of what we're going to cover in this meeting. So we're going to start with a brief outline of our global collaborative evidence mapping projects integrating medical service provision and nature conservation worldwide. And then Joe is going to discuss identify barriers to scale up siloed funding for either health or conservation. And then potential solutions, process to develop international funding guidelines to support integration of biodiversity conservation and medical service provision. And then after that, after Joe's presented on that, we're going to have a discussion which is going to revolve around the question of what are meeting participants' experiences with funding streams for integrated health and conservation projects. So with that overview, I'm going to hand over to Joe.
So, hi, my name's Joe Middleton from Brighton and Sussex Medical School in the UK. I'm also involved with Services Papua New Guinea, which is integrating health and conservation in the rainforests of Papua New Guinea. So we have built a clinic in quite a remote area which was medically underserved, and linked to that clinic building, we've expanded a conservation area to 150 square kilometres as a result of that kind of health incentive, and we're obviously improving the health of the communities in that area. And we're starting to expand elsewhere across Melanesia as well. So when we first set up this project, we were looking around to learn from other people's experiences. To be clear, this project wasn't something that we envisioned conceptually. It was a direct response to community requests of indigenous people in Papua New Guinea who were already engaged in conservation. We worked with these people for over a decade, providing services and providing resources to empower them to be able to continue to defend their forests against the threat of logging. So as part of that kind of community participation process, we were asking them, what do you need out of this collaboration to enable you to keep that sustainable pathway? And we already built a school in that community, provided transportation to secondary care. This is an area which you have to go about 40 miles down logging roads, and then informal, river crossings up to your waist, and then hike for a couple of hours to get to the least remote village. So we provided transport from the trailhead. We provided these kind of services as well as involving them actively in biodiversity research as well as conservation. But after 10 years, one of the resources they felt they really needed was actually in-community primary care. So as that was the next stage of our collaboration, we decided to reach out to people who've done similar work and find out what their experiences were. And we spoke to many really experienced providers such as Health in Harmony, Conservation through Public Health, etc. We also found there was a lot of projects worldwide which were bolt-ons to existing conservation programs that weren't necessarily ever reported in the academic journals or already reported outside of small NGO reports. So one thing we did is we decided, okay, once we set up our project and we've been running, it's been going for 6 years, we decided for people such as ourselves starting off on this kind of journey, it'd be really helpful to have evidence of integrated health and conservation projects worldwide. So working with Health in Harmony, Conservation through Public Health, and other Planetary Health Alliance members, we did a collaborative mapping of integrated health and conservation projects worldwide. So these are projects quite narrowly which just provided medical provision with the expectation of both health improvement outcomes and biodiversity outcomes. So there's obviously a wider universe of health and conservation integration, trying to stop zoonotic disease spread, etc. But here we're quite narrow inclusion criteria at medicine given, aiming for health improvement and conservation improvement. So you kind of see we've got a large list of collaborators there, many of which are from the Planetary Health Alliance. So I'm going to very briefly take you through the findings. So the geographic distribution was unsurprisingly mostly but not entirely in the global south. This reflects the fact that we didn't include things like park services. Parks in my country, in the UK, were historically developed for health aspects as well as conservation aspects. So they were for health improvement in terms of exercise as well as biodiversity conservation, but they didn't provide medicine. So our narrow inclusion criteria was looking specifically at providing medicine for health outcomes as well as conservation gains. So that is reflected in the distribution of the kind of projects we were looking at. By far, Africa had the highest number of projects, followed by Asia, and then Latin America. So habitat distribution, the habitat that these projects were in most common was tropical rainforests. In fact, wet forests had 22 projects, but a range of other habitats across the world were also involved. Beyond wet forests, probably one of the leading ones was corals as well, in terms of marine conservation. Intervention types, so to be involved in the mapping, all projects had to be providing medicine. What kind of medicine they were providing? Well, the most common form of treatment that people were providing, or medical service, was family planning, and it's unsurprising, reflecting the long-established, PHE process from the 80s onwards that linked family planning and reproductive health with conservation. But even when family planning was the key service that a project was providing, nearly all of them were also providing other medical services, not just reproductive health. So although it was the most common provided service, those clinics were usually also doing something else in terms of medical provision. Beyond explicit medicine, most of those projects were also involved in a conceptual focus. As well as giving medicine, they were trying to link the protection of natural systems to the health of communities through education programs. Beyond family planning and education, the next biggest area was clinic building, so very similar to what we've been doing in the Wenang Conservation Area in Papua New Guinea. Many organisations built aid posts or clinics in remote areas, or utilised park rangers, for instance, as ancillary medical professionals. And that could go from quite small projects, aid posts, maybe staffed by a nurse, up to the entire construction of a district hospital serving a large area of an African country, carried out by the Royal Society for Protection of Birds, of all people. So a wide range of kind of interventions, and I'll be talking more about this actually later on in the conference this week. So in terms of evidence of effectiveness, so there was good quality project evaluations. Health in Harmony is an example of demonstrating that integrated medical provision and conservation could be highly effective, but we did see some projects lacking reliable evaluative methods. So projects were very often set up by NGOs in response to community request. So they didn't necessarily even have baseline health data or baseline ecological data, because they're already well into the projects before they started to think about the methodology at which they'd truly evaluate them. Similarly, it was very rare that projects had health outcomes and conservation outcomes matched at the same time point. So it was difficult to sometimes see whether the one outcome was directly related to another outcome as stipulated in the theory of change of those organisations. Finally, there was very rarely comparator sites. So for instance, there was a very good study which showed a reduction in logging linked to health provision, but there was no comparator sites where health provision hadn't been given, so it had been difficult to really say, in a kind of randomised controlled trial way, whether that reduction in logging was definitely as a result of that health intervention. So this is not me saying that there isn't an evidence base for these kind of these projects. There's many good evaluations showing it works, but it is showing that many of the projects, largely because of the history of how they developed, didn't start with a plan which really has a strong ability to evaluate at the end. And so that's one of the things we're looking to try and help with. So in this image we've got up on the screen, that's the interaction between conservation outcomes and health outcomes in the theories of change of those organisations. So we looked at that quite in depth. Also, we looked at who funds them and what kind of problems projects had. So we did find they were highly effective, but we did find that funding was a major barrier to projects. And this is not so much that there's not enough money. I mean, everyone doing anything in medicine, anything in conservation is always going to say there's not enough cash. The problem here was that people were finding resources either from health funders or from conservation funders, but those funders had siloed funding streams. So although practitioners on the ground were trying to do synergistic interventions, working across sustainable development goals on health, on conservation, When they went to get the money to do that, they were having to go to either health or conservation organisations in most cases. And that siloing of funding streams exacerbated the problem of outcomes not being matched. So if an organisation got money, for instance, to do a nutrition project 1 year for their integrated health and conservation project, but they got biodiversity funding the following year, the outcomes were not going to match. So that problem that we saw in terms of lack of evaluative design was being exacerbated strongly by the way that funding mechanisms were skewing projects, despite the desires of the people involved. So this was identified not just by us, standing externally doing the mapping, but by many of the people we spoke to. So we spoke to 48 organisations across the world who were collaborating in this mapping exercise, and this was by far the most common problem that people said was facing their organisations, this issue of siloed either health or conservation funding. So to tackle this, we're looking to do further engagement and development of evaluation guidelines, and as I say, we'll soon be publishing the results of our mapping. But the work we've done so far on the mapping exercise is a huge amount of collaborators. While I'm presenting it, I don't want to claim to be responsible for all of it. It would have been impossible without the submission of data and involvement of organisations all over the world, especially in the global south. So coming back to this identified barrier. So as long as this is in place, it's very unlikely that we're going to see a significant scale up of this kind of synergistic intervention on SDGs. This is despite the fact that we know that Sustainable Development Goals are in crisis in terms of their ability to be realised. This was true well before COVID-19. It's definitely even more so the case now. So there's a real drive within the UN system to try and support synergistic action which simultaneously acts on more than one Sustainable Development Goal. In our case, that's obviously health and conservation. So building on that kind of momentum that's already somewhat in those institutions, we're looking to support the development of international finding guidelines to support the integration of biodiversity conservation and medical service provision. And our strategy for doing this is simple. So if we as practitioners, so I'm on the ground involved in this kind of integrated work, if we tell funders what they should fund, the chance of that working is very low. What we need to do is we need to get funders, international funders and UN related organisations, UNEP, etc., UNDP, into a room with practitioners to discuss this problem and decide guidelines to both shape how integrated conservation projects work, but also how they can be evaluated by funders. And in turn, these guidelines hopefully can be incorporated into future funding calls by those organisations. And we've spoken to various providers from the UK, such as the Darwin Initiative, DEFRA, to USAID and others, and we do have some traction on this. So we're working now with the Foreign and Commonwealth Office of the UK government to set up an international roundtable next summer, bringing practitioners, funders and policymakers together to set these guidelines up, and with the aim of kind of launching them at a high-level meeting on the UN on Sustainable Development in September 2023. The work is being done by us from kind of University of Sussex, including Joe Akoma, who's very much leading some of the policy work, who used to be the chief scientist of the United Nations Environment Programme. So that's our kind of blurb for why we're doing it and what we're trying to do. And we want to be clear, we're not in control of this funding ourselves, so this strategy might not work. But it was a very clear call from many of the projects on the ground that this was a barrier to their scale up. And we thought, as one of those projects ourselves, we want to work with other people across the network to see if we can bring this together and kind of shift this at a relatively high level. Because if we each try and chip away at it as individual projects, we're probably not going to get very far. So yeah, that's all from me. So I think we're going to go to a discussion now, and primarily, I've spoken enough, so I'm happy to take some questions now. But what will be really good in a moment is if we sit round a table. I think we'll move the mic for those of us who are here in the building itself, and just chat about what kind of participants' experiences with funding streams have been for integrated health and conservation projects. And we're really interested in listening to problems as well as solutions. And as long as people are okay with it, we'll be continuing to record the session, and some of your ideas will hopefully go into that guideline development. To be clear, we're very keen on people here being involved in an ongoing process. And some of you from organisations would be keen, if this goes ahead, to bring into the International Roundtable in the UK next spring. So I think that's it from me. Okay, so should we go around?
Yes. So just start me. So my name's Jessica Stockdale.
Make sure to raise your voice so I don't pop up.
Sorry, my name's Jessica Stockdale. I'm based at the Brighton and Sussex Medical School in the Department of Primary Care and Public Health. I'm a philosopher by training, and I work with Joe on the P&G collaboration that he's just been talking about.
Hi, my name is Kirsten Dodro. I'm from the Center for One Health at the University of Global Health Equity in Rwanda. I just finished up graduate school and I'm looking to go into this field at the intersections of conservation and human health delivery.
I'm Joanna Canedo, work for Pathfinder International, which is based here in the Watertown, but we work in 17 countries in Africa and Southeast Asia, and Tanzania and Bangladesh and Egypt are countries where we have had experience with working with conservation and family planning. In this country, so we have projects that ended and others that are beginning actually this year, new ones, because I think there's more demand for this at this point, I think. And at COP27, one of the reasons we're going is because lots of ministers of health are now interested in joining the conversation and bringing this to the international realm.
So I'm Joe Middleton. I probably didn't say who I was beyond saying where my institution was, but my clinical background is in emergency care, but I'm also trained as an ecologist. I've worked in Papua New Guinea, supporting indigenous-led conservation in different ways for about 20 years. So.
Hi, my name is Tomomi Nakao. I'm from Japan, and now I'm working for a Japanese think tank, and I usually do some research about the medical policy, and recently I'm working for the Department of Healthcare in Japanese the Japanese government, and do some projects related to the countermeasures, medical countermeasures against COVID-19. It's nice to meet you.
Nice to meet you. My name is Nina Finley. I'm with Health and Harmony. I'm research manager, and we're an international nonprofit that was mentioned a few times there. We work on regenerating rainforests by listening to rainforest communities and investing in the solutions that they design, and those tend to be holistic solutions that involve healthcare, livelihoods, training, and education. We work in Madagascar, Brazil, and Indonesia.
Yes, I'm my name's Jeremy. I'm the Senior Program Coordinator at the Planetary Health Alliance, so it's fun to participate in actually a session. My background's in conservation and particularly intersecting it with health in Madagascar and Indonesia, and then I worked with Health and Harmony doing one of their studies in 2017 in Bukan National Park at one of their sites, and so very interested in this topic, moved on to the global coordination realm with Planetary Health Alliance, but we just received observership with the Convention on Biological Diversity and looking to bring more health voices into the biodiversity realm, and also partnering with other alliances that work in biodiversity, so this is a very pertinent conversation.
And I think we were going to say earlier, but this session was set for 5, but I know you're showing a film about health and harmony and related work at 4:30, so we'll definitely be finished before then.
Right next to
Yeah, that's fine. So, not least because I want to go and see it. I don't actually know if we've got anybody online. Have we got to be online?
No, we have one guest, Mohammed.
Is there a way he can introduce himself?
You can make them a panelist.
Sure. Thanks. Thanks everybody. And sorry, I'm not in the room there, but this is a topic of great interest to me personally. But I work in the Global Environment Facility in Washington D.C. I was supposed to be with you actually, but due to unforeseen circumstances, I couldn't attend in person. I'm on a panel tomorrow, and hopefully share some perspective. But this topic is definitely of interest to me. So I look forward to participating in the discussion. Thank you.
Thank you very much.
Great. So we just wanted to have that discussion and say we're recording it, and probably will take part. Anything you say now will kind of inform the way these guidelines develop. But we very much want to. It's not something which we're producing out in the UK. We want to do it kind of collaboratively, not just at the roundtable, but in a kind of ongoing process. So so maybe if anyone could talk about who's involved in these projects or be involved in funding them, about your kind of problems and solutions for dealing with this kind of funding issue. So I don't know if Pathfinder, do you have a perspective on some of these kind of projects?
I'm not sure how much in-depth perspective I can have. I know more of the projects in the surface, but what I do know is that things that recently, when it's more of not foundations, but more of corporations that are willing to invest. And so the investment we had was from Takeda, for instance. And but also the partnership with the Nature Conservancy made a huge difference for the project in Tanzania. And Egypt, I forget now who was the funder, but it's growing a lot, and the projects that are coming to us are more related to but also because the organization decided to create a department dedicated to climate and women resilience.
That's good to know. And was do you, in terms of that core funding on the ground, have you had much involvement from UNDP or any of the other kind of policy, the global level on supporting that funding?
Lots of our funding is supported also by USAID, but the corporate, like the Takeda one, was just Takeda, for instance. So.
Okay. And have you got a perspective from Health and Harmony on this at all?
Yeah. I think in my experience, there's been some funders are really aware of this and really will mesh their metrics and their goals and their outcomes and their funding on health and conservation, but that's the minority. Recently, we had a submission to a very wildlife and forest focused funder, and put forward the solutions designed by communities that we invested in Madagascar. So primary healthcare, agriculture training, supporting public school systems, with the outcomes still being in the realm of lemurs habitat conserved, standing forest preserved, and reforestation, things that were very sort of at the core of this foundation. But it was not successful, and we received the feedback to try submitting it to a development organization because clearly we're doing development, not conservation. And this is a pretty common, in different ways response, even though we have found in 15 years of evidence gathering that these solutions are conservation. They're very successful at conservation of forests, more so than a lot of solutions that are not human inclusive, like just studying a forest itself. But there's still this expectation among funders that solutions for forest conservation will only be forest activities. And when you look at the drivers of deforestation, they're economic drivers and human drivers and healthcare drivers. But those still aren't being necessarily funded by organizations with a conservation remit. So I think that recognition of how important a thriving community and thriving human community is to a thriving forest is still growing and needs to grow.
So that's interesting. And so that reflects what a lot of the contributors to the mapping project said. So you're saying there about kind of reaching out to a conservation organisation with health intervention as a successful way of getting a conservation outcome, and then being kind of somewhat rebutted on the basis that it wasn't perceived to be conservation because you're providing, treatments, medicine, etc. I wondered if there was a similar experience in the other way around that Health Harmony has had in terms of trying to go for health funding, but then being interested in conservation outcomes.
Yeah, absolutely. I think what we've run into when we're looking at health-focused donors is that, or development-focused donors in things like WASH or public health, is they'll have a certain idea oftentimes of what constitutes sort of an effective or a high output program. So are you seeing the maximum number of patients with the most need and treating, say, the most dental cavities, or giving the most immunizations per dollar is often like a way that these projects are evaluated. And oftentimes when we're working in a more holistic way, you're not going to get the most vaccinations or cavities filled per dollar, because there's also funding that's going towards community engagement, to reforestation, to watershed protection, to monitoring forest outcomes. So which we have found are healthcare measures. Like a healthy forest provides water, that is a preventative healthcare measure, and a healthy forest reduces vector-borne disease, so it's a preventative healthcare measure. But healthcare funders don't tend to see the conservation contributions to health. So they'll often pass us over and say, no, we're going with this pure hospital that does more vaccinations per dollar, when that hospital doesn't improve the forest at all. But it's hard for health funders to have the metrics to understand that vaccinations are an important outcome, and how healthy is the forest is an important health outcome as well.
And so in terms of, Health and Harmony historically has been involved primarily in Asia, and then obviously you've reached out now more in the last few years down there to Madagascar and the Americas. Has there been any spatial difference in those issues, or is there a kind of unification, because the funding's coming from the global north anyway? Has there been any dissonance with this kind of issue?
It's a great question. As someone who's not directly in the development section, there's others who could speak to that more specifically, but from my experience in research, I would say the landscape is pretty different in the different contexts. So in Madagascar, there's, I think, an understanding of PHE and some of the things you showed on your slides of the fact that I think in Madagascar it's very clear in some places the connection, because there's just such a need for clean water and basic food, and then many of the health outcomes are things related to unclean water, malnutrition. So I think that makes it more visible, not necessarily at the level of funding, but at least at the level of actors kind of on the ground being aware of these connections. It feels present. In Brazil, it's a pretty different landscape in that we're working with indigenous and riverine communities who have a pretty strong articulation of indigenous governance, and rather than providing like public health measures, we're really working to help keep forest-dwelling people on the land if they want to be there. And that has been less on the we do direct healthcare provision, but there's also a big element of advocacy for whatever it takes for people to stay on their land, whether that's land rights, whether that's support from the government to protect from land grabbers and gold miners. And all of these are really related to healthcare, but they're not like the narrow inclusion of providing medicine, although we also do that in Brazil. So I think that's like a centerpiece that funders in Brazil do tend to recognize as holistic. So if you support indigenous communities to stay on the land, that it has forest benefits and it has health benefits, rather than in Indonesia and Madagascar, usually the narrative is directly about healthcare and forests, right? Like provision of a clinic to keep forests standing and vice versa. But in Brazil, I think the dialogue is centered on like the indigenous and riverine communities' rights to be, and then those are all flowing from it.
Yeah, it's interesting. And and you don't, obviously it's not appropriate to name funders, in an open call here, but those are there a different type of funder that's funding it than some of the other projects, given that slightly more holistic badging?
Yeah, I would say the funders who we've had really good relationships with and understanding that holistic pattern in Brazil are sort of a specific set of funders who recognize that intersection of indigenous and local community leadership and climate outcomes and health outcomes. And like that is a core part of their mission. It's not something that we've taught them. I think those funders tend to come to us knowing about that connection, and then we have this synergy because we also work at that connection.
Yeah. So the main funders of our projects, main fund of our projects is UK government aid from something called the Darwin Initiative, which is kind of an overt project. So that's why I'm okay to mention the funding. But that came out of the 1992 Rio Earth Summit and was as a fund to enable Britain to support global south countries to fulfil their obligations for both poverty alleviation and conservation. biodiversity. So they've already started, because they started aiming to do both simultaneously. They've accepted health as a subset of poverty alleviation, effectively. So we've been lucky. We found it relatively easy to get funding on a synergistic level, but but that I think is a barrier generally. We've looked at other funders, I know our collaborators have. So it's good to hear that in Brazil, with that kind of slightly different framing, that you've managed to get that to work as well. That's really good. Is there anybody else have anything to say? Hasn't spoken yet around the table?
I think just some questions. So when you're talking about this this get together of leaders, UN officials, different funding agencies, what's the role of bringing in the local communities into that space to set metrics? Because you mentioned policy people, government, and
practitioners.
Yeah, practitioners, and so much of what metrics actually need to be achieved, I think, are determined by the local communities. So, is there a plan for that?
So I think it depends on the projects involved. So, I mean, the project that we do, it's a really good point. The project we do in Papua New Guinea, as I said, was a response to local community demand from a long-term Indigenous-led collaboration. Many conservation projects which have had a kind of not just a health aspect, but maybe an aspect of development for conservation, almost in a kind of transactional nature, have been very much based around this kind of fortress park model, where there's an area declared for nature, and then somehow you've got to stop that being destroyed by the surrounding people who don't live in that area. Our project, the community retain all land rights. In actual fact, 97% of Papua New Guinea is under customary land ownership, so it's not under individual land ownership, it's under customary land ownership. It's collaboratively managed by clans, where we are, and they retain land ownership, they retain all decision making. There's no direct government involvement. There's no direct control by outside funders. So in our situation, with our project, it'd be very clear that we would be bringing people who are leading the project, and that's people on the ground. Not because they're the community that we work with, but because that is the people doing it. They're the people evaluating it. They've been trained as biodiversity researchers to go and collect the data which evaluates the project. They decided and built a health clinic. They're kind of managing the process. And from my perspective, that's a kind of an ideal situation. That's why I was inspired with that project. And I know Health in Harmony, for instance, also involved in kind of a perspective of radical listening, starting from the perspective of what the community themselves says. But other projects may not be like that. So some projects might be in a much more service provider kind of role. And I think it's probably important to bring all the projects who are working in this kind of integrated way involved. And so obviously I'd encourage anybody who was there, any groups that were there, to make sure community representatives were there as part of their delegation. But obviously, we'll do that with ours, but some projects just don't do that, for good or bad. But I think it's an important point, and I don't think there can be a universal metrics set up. Different communities are going to be in different places, obviously. But I think the structure of evaluation probably can be somewhat universal. For instance, it probably makes sense to have some way of demonstrating what the attitudes of the community are to the project before and after the funding deadline. It makes sense to be able to evaluate what the conservation outcomes actually have been. So, for instance, I could think of one project, a marine project, which advocated for medical provision would, its theory of change, result in improved attitudes to conservation, and therefore reduced pressure on this one species, marine species, which would result in preservation of the wider marine habitat. And there was evaluations for the medical provision given out. There was evaluations for whether this fish population went up or down. But actually there was no evaluations seeing if there was a link, temporal or otherwise, spatial, to the health intervention to that fish population changing. And most importantly, there wasn't an evaluation of what actually the overall health of the marine habitat was once that fish population went up. And actually scientifically it's just as plausible if you see top predator species go up, you might see an escalation of problems as well as depends on the structure of the habitat. So I only say that in the sense that I don't think the granular, specific, evaluation metric can be designed globally. In fact, that's a problem with Sustainable Development Goals, isn't it? But the structure of the way we evaluate projects, I think, can be. And yeah, you're right. That should be community-led. So from your perspective, if you've been involved in this kind of projects or you're interested in doing that kind of work, what would you see the best way of bringing this kind of community perspective into such a process?
So I want to be clear that so you're having different organizations that are working in this space in different ways, coming together to set guidelines or these strategies for evaluation. It is so project dependent. Like, I know it might be different for you to bring members of the communities that you're working in partnership with versus, I don't know what that would look like in your work. But I think if the leadership of this conference can really emphasize the importance of each group bringing representatives from different backgrounds and not just saying, I want your top 3 PhDs, I want a holistic representation of the work that you're doing. And maybe if some of these organizations don't have those readily available community ties, that's a good indicator that maybe there should be more Indigenous or local voices in their leadership. I would love to hear other thoughts on this. I don't have all the answers.
I think that goes to an important point of coalition building and regionality. That's where the work I did in ocean conservation in Indonesia with Coral Triangle Center, they worked with Coral Triangle Initiative for Food Security, Fisheries, and one other F, I can't remember. But it was 6 countries of the Coral Triangle have banded together, and they were able to receive, they were completely Indonesian nonprofit, kind of the bridge between local communities and the higher up development groups. But because they were a part of building this coalition, then that got the attention of outside funders too. And because it was a 6-country coalition, that got the attention, and the countries also wanted to band together and pool funds. And so it's not just program specific or organization specific work, but it's having this kind of group come together that then can pool and figure out what needs to be done in our contextual specific region. Because what has to be done in the Coral Triangle is going to be very different than what needs to be done in Brazil or the Americas. And so also with this mapping part, I think there are some universal measures that can be made, but I think it will also need to be in some ways very contextually specific depending on different regions you're working with too. And in terms of who you're inviting, not just the UNEPs or UNDP or groups like that, but inviting these regional coalitions. There's groups in Africa as well that are really at that bridge point of the different organizations, and that's really what got Coral Triangle Center, who are now, they're kind of leading the work being done in that area to be so successful.
Okay, great. I mean, just to be clear, I suppose although the end point, I don't really care about bits of paper and writing journal articles and guidelines. I do that enough already because I'm an academic. But the end point should be like, improved health and improved conservation on the ground. But having said that, this kind of process is not going to be, can't strategize to do that somewhere. The aim is, the aim really is to think about creating a process by which funders feel embedded in kind of co-planning their own development of grant schemes to support this work. Informed, as you say, by Indigenous communities and by practitioners. Because if we just tell them what to do, they're not going to do it. It needs to be collaborative. So I mean, on that level, there does need to be. Unfortunately, the majority of the money is in the global north, so it needs to be global new north biased in terms of the funding providers. But I think not. So there's limited in regionalisation because of where the money is, unfortunately. But I agree. That's important, and I think we're aiming to try and get people from such projects in most of the global south continents at the very least, to come along. If it goes ahead, which it might not do, I mean, if it doesn't work out, we'll try a different plan, but this is our plan at the moment. It partly depends on the extent of agreement and buy-in from the UK government, actually. It would be very supportive at the moment, but
What's your
strings.
timeline?
Sorry?
What's your timeline?
So we're aiming to do the international route. So we've got another meeting, actually next week, which is online, as part of the Sussex Technology Research Programme Sustainability Week. And I'll make sure to put that information on high-low afterwards, so that anybody online can see it and join. And we'll be getting input from all the people who've been involved in the mapping exercise, which is 48 organisations from 22 countries, over the next 4 or 5 months, with the aim of, if the International Roundtable goes ahead, having it in kind of February and March, with the idea of then spending 6 months developing the guidelines, making sure that they're badgeable by funders, because it needs to be jointly badged by funders in a way that results in there actually being grants afterwards in this way, and then being launched potentially at the September high-level meeting on Sustainable Development Goals in New York in the UN. So it's quite an ambitious timeline, but that and it might not work. But that's our aim at the moment. And I think you were saying earlier that you've had quite a lot of support for this kind of intervention building up. I think that is true after COVID. There's definitely appetite to think about integrating this kind of work. So I think there's a good opportunity to do it. It may work, it may not. But that's our kind of thoughts.
We'll definitely let me know, PHA, know beyond high-low, like direct email.
Oh, of course. Yeah.
Because we're going to be potentially starting a partnership with Global Commons Alliance.
Great.
And so kind of building in that whatever we can do to help with this, and we can look at it first. And if you're doing anything at CBD, let us know.
Yeah, definitely. We presented actually some of the mapping work as part of the Cumberland round earlier in the year. But yeah, definitely the idea would be to have a bit more engagement with CBD as well. But so that's useful. I wondered if anybody online had anything to say.
Mohammed is still there?
Yeah, I'm still here. Thanks very much. No, I was listening attentively. As a donor, obviously, I have to take all of these points that you guys are making into consideration. But just to also remind us all that we have come a long way in resolving many of these challenges, at least from an operational standpoint, because of course it's no secret that donors have to focus on the outcomes for which the resources are being targeted. But I think the overall approach, in my opinion, is rapidly evolving. And we are talking more now about integrated approaches, where it's not about the outcome, but rather the approach to delivering that outcome, which then delivers multiple benefits or co-benefits, depending on how you want to look at it. But more importantly, putting people at the center of the approach, so that whether you're doing conservation that is targeting a biodiversity outcome, the question still starts with, how do the local communities fit into the equation? What's their role? How are they going to be affected? All the issues around free and prior informed consent, which more or less allows them to have a say in what the methodology is, what the tools are that are going to be used, and how is it going to bring any kind of positive transformation in their livelihoods, as opposed to an incremental change that is akin to what we used to call the so-called ICDPs, the Integrated Conservation Development Projects. So I will say that we have made a lot of progress, and hopefully the work that you're doing will start to get more at the metrics. How do you then fulfill the monitoring aspect so that the sources of those funds can still appreciate the overall value add of what the outcomes are, as opposed to just focusing on that siloed approach that has never worked. So good to see that this is happening, and I look forward to learning more about the outcomes. Thank you.
Great. Yeah, thank you, and thank you for joining us online there. And it'd be really good. I think you said you're speaking later in the week, are you? In one of the sessions?
Yes, I'm on the panel tomorrow morning, where we're going to be sharing perspectives on some of the experiences around the world. So I think it's the first panel in the morning. So
wonderful. So we've taken emails of the people here in person. so that we can follow up with what's happening with the next meeting and what will be happening with the International Roundtable and generally developing the process. So as you're speaking on the panel, I'll get your email contacts if that's okay with you from Jeremy.
Yeah, I'll put my email in the chat now. So, oh, I guess the chat is disabled, so I'll put it in the Q&A. I'll put it in the Q&A.
Okay, sounds good.
That's wonderful. Thank you for that. That's really useful to have a perspective from a donor agency as well. Really good, really useful. So I think we're coming up to 4:30 soon. So and I know your meeting's starting at 4:30. So so as I say, how the process will happen now is we're disseminating the results of the mapping. We'll then be reaching out over the next week to all the collaborators in the mapping process, most of which are on the ground kind of conservation organisations, people doing this kind of work, and then trying to get people's perspectives more. So it's been really helpful to listen to you as well. And then we'll be developing some of those draft guidelines and looking to have that roundtable meeting next year. If that process, if we can't get enough buy-in from the needed organisations for that, we'll think a different strategy. But we're quite committed at Sussex to kind of trying to move this forward. Did anybody have anything else they wanted to say before we kind of finish? Or we didn't hear anything from you, but there's also no pressure to speak up.
Can I say something?
Yeah,
of course, yeah.
Sorry, I'm not good at speaking English, but I have a background as a veterinarian, but I got a PhD as a medicine and for human healthcare, and I feel that there are so large differences between the amount of funding for the human health and for the animal health, and many my colleagues, many veterinarians, changed their direction of their research to towards the human health, like cancer, research of cancer or infectious diseases. These are good for human health, but like conservation or other wildlife, wild animal health is not the good for the human. So many colleagues have to change to their research topics to get the funding. So this is the real situation in Japan. So I want to change this situation. So that's why I joined this meeting. So thank you.
Okay. And that's really interesting. I think I've heard from colleagues in One Health very much that although it's an aim to do integrated work for animal health, wildlife health and human health, the reality, because of some funding streams around zoonotic disease, is people who've been obviously trained to be veterinarians because they wanted to help animals and ended up having to follow the money to be able to work on zoonotic disease, with the outcome being human protection without necessarily there being habitat protection involved. But I think that's something, there's a risk even with some of the kind of projects that we're doing, is that you can lose contact with what always is the driver. But I'm hoping that isn't going to be happening with these kind of integrated conservation health projects. But I think that issue from One Health it's good to bring that up actually, because I know there's been a parallel situation for quite a while. So thank you for the contribution.
I was going to say, for people who might be watching the recording of this, not live, but in like the weeks after this goes out, I wondered whether we wanted to give one of our email addresses in case they wanted to also share their experiences, sort of like post-meeting.
Yeah,
so
absolutely. So if you're listening, as Jessica says, if you're listening online after this event and you want to be involved in this process, please get in contact. So on the slide screens, is that still showing for people at the moment? Yeah. The email's up there, so j.middleton@bsms.ac.uk. And this is not a kind of situation we're looking to just arrange from the UK. We really want this to make this a collaborative process, and this is just really at the start of it. So it might change quite drastically, and that might be positive with your input. So please do get involved.
Excellent.
Okay. Let's finish and go and see the film from Health and Harmony.
Thank you.
Thank you.
Thank you so much.
Thank you for your contributions.